Hi guys, welcome to Healthy Living with Nosmo, the channel where health finally makes sense. So last week I put out a poll about what health conditions we'll be talking about this week. And if you did guess type 2 diabetes, yay, you did a great job. Now welcome to the series 1 of Living Well with Type 2 Diabetes. I'm sure you're wondering, is it possible to live well with type 2 diabetes? Sure, you can. You definitely can. But before we can talk about managing and living well with type 2 diabetes, we need to understand the root cause. We need to know what's going on in our body. And that's the only way to truly address the main issue here. So I've heard a lot of people say, oh, I can't eat this and I can't eat that. And that's true. If you have diabetes, you should be on a diabetic diet. However, you need to understand that type 2 diabetes is not only about the sugar, it's your body not responding well to insulin. It's an insulin resistance. Now, what happens when you eat your food, when you take in your food, that food turns into sugar. The sugar goes into your blood, and from the between the blood and the body cells, right? There's an insulin that should carry that sugar into your body cells, such as your muscles, your fat, and liver cells, right? That should go in there. However, when the body is resistant to the insulin, the sugar then stays in the blood, and that's where we see the blood sugar go high. Over time, once this blood sugar continues to stay high, it can definitely cause serious health problems. Okay, it can affect the kidney, it can cause vision loss, it can cause heart diseases. I mostly see patients that come in that have type 2 diabetes. They tend to have hypertension, tend to have hyperlipidemia, because what happens is diabetes is the center of it all, and it begins to affect the entire system if it's not well controlled. So again, we're taking from here knowing that it's not just about your sugar, it's not about what you take in. It's an insulin resistance. Okay, so you need to stay on your medications. If you're taking insulin, you need to stay on your insulin, right, to be able to control that, because you can't stop eating, but you can manage what you do eat. We're gonna get to that part later. Okay. Now, you may be wondering, who's at risk? Am I at risk? Are you at risk? Are we all at risk? I'm gonna break down to us who can be at risk. If you're overweight, it's very important that we monitor our weight and manage our weight. If you're overweight, if you're obese, you need to manage it, you need to control it, because that can lead to having a high blood sugar. Okay, again, what's happening is you're eating this food, the sugar is staying in your blood, it tends to have high blood sugar. Now you're eating the food, you're not burning it off, you're retaining so much fat, you're retaining so much sugar in your body, and then you can have diabetes. Now, if a blood test has been done to determine that the blood sugar is within a certain range, a person can be called a pre-diabetic. As pre-diabetic meaning before they become diabetic and diagnosed diabetic as diabetic. So that's another risk factor right there. Another risk factor is being 45 and older. Age is a contributing factor to most health conditions, whether we want to agree with it or not. Age is definitely a contributing factor. If you have a family history of type 2 diabetes, yes, you're more likely to have it if you're not careful. And even when you're careful, even when you try your best, sometimes it still pops up, it still happens. And so you have to manage it. You have to control it and live well with it. Because at the end of the day, if you don't live well with it, it can cause other serious health conditions. If you're physically active less than 3 times a week, you need 30 minutes of workout 5 days a week. Okay, so please get into it. Start working out, start staying active as much as possible. If you've ever had gestational diabetes, and this is diabetes during pregnancy, sometimes some people tend to have that when they're pregnant and it doesn't go away. And for some people, it will go away. The same thing as hypertension. It comes during pregnancy, it stays, and it stays forever, or it definitely goes away. You're not too sure if it's going to stay or go. But people who tend to have gestational diabetes have it long term, even after having the baby. Where we come from, our race, our ethnicity plays a big role. Studies have shown that Asians, blacks, African Americans, Hispanic or Latino, American Indians, Alaska Native, all of those descendants have a higher risk of having type 2 diabetes. So again, myself and you, we need to be careful. We need to make sure we're monitoring everything. People who have non-alcoholic fatty liver disease, tend to have type 2 diabetes as well. They are at risk of having type 2 diabetes. So just to recap on that, if you're overweight, if you're 45 and older, if you have a family history of type 2 diabetes, if you have ever had gestational diabetes, right? It can stay after pregnancy or it can go away after pregnancy. Your race also determines that, right? Is a risk factor. It puts you as a risk factor. If a person has non-fatty liver disease, it's a risk factor as well. Okay. And it doesn't necessarily mean that they will get it, but it's just a risk factor. Who is at risk? Those people are at risk. With type 2 diabetes, it's most people always think of, oh, high blood sugar. My sugar is going to stay high. My sugar is going to stay high. But there's also low blood sugar common in type 2 diabetic patients. Okay, there's low blood sugar, very common. And what happens? Why do they have this low blood sugar, high blood sugar? We're going to talk about that real quick. Okay, missing a meal as a diabetic patient, as a diabetic, missing a meal can cause your blood sugar to drop. So it's important that you don't miss a meal. It's important that you eat the right type of food, eat at the right time. Taking too much of insulin or overdosing, okay, overdosing because, oh, I'm trying to control my sugar, so let me take a little bit more pill, let me take a little bit more insulin so that way it can drop, especially at nighttime. If you're a diabetic, be very careful, be very watchful of what you do and how you take your medications at nighttime. If you take an extra dose, if you take an extra insulin, your blood sugar can drop before the morning, because remember that you're going to bed to sleep, right? You're not eating through the night, and so your body is using up what it has stored up, and then by the morning time your blood sugar is low. Okay, taking other diabetic medications, right, combining, unless it has been prescribed to you by your physician, by your doctor, please do not self-medicate and do not take different diabetic medications. Okay, because when you do that, it can drop your blood sugar as well. Being more physically active than usual. Again, we want our diabetic patients, we want people who have high blood sugar, who have low blood sugar, who have high blood sugar to work out as much as possible, 30 minutes minimum, but do not overdo it. Do not overdo it. Too much of physical activity as well can cause your blood sugar to drop. So you have to manage it well, you have to control it. So you're not having low blood sugar today, high blood sugar tomorrow, because that means it's not being controlled well. Okay, drinking alcohol. The two things: drinking alcohol, drinking caffeine, that's it. High blood sugar, low blood sugar, avoid alcohol, avoid all this caffeine. You don't need it. Okay, there are other options, there are other alternatives to take, but drinking alcohol can cause low blood sugar. What is causing our high blood sugar, on the other hand? We already talked about it, but let's pick on some of them. Being sick can cause a diabetic patient to have high blood sugar. Okay, if you're already having type 2 diabetes and you're sick, it can increase your blood sugar. Okay, being stressed. A person who has type 2 diabetes should not be stressed out. When you're stressed out, you're increasing your cortisol level, and again, high blood sugar. Okay, eating more than usual. Again, we need to control what we eat. We need to manage what we eat. You can eat some of the food that you like, but again, you need to manage it. You need to control it. If you need to see a nutritionist, if you need to speak to your physician, please speak to your physician. Okay, and that way they can give you the right advice, the right medical advice. It's very important that we stick to our prescribed medications. If your doctor says once a day, with meal, after meal, before your meal, please stick to it. Try as much as possible to stick to it. If you're taking metformin, if you're taking insulin, if you're taking Jardiance, whatever medication you're taking for your blood sugar, please stick to it. So, and if you think that, oh, my blood sugar is not being controlled properly with these medications that I'm taking, speak to your doctor. Okay, speak to your physician and let them know your concerns. All right, now if you check your blood sugar again and you see that it's being controlled, it's within the normal range, that's good. That doesn't mean that you should stop taking your medications. If you think that taking your medications drop your blood sugar, speak to your provider, speak to your physician, speak to your doctor, speak to them and let them work with you to figure out what to do or the other medications to be on. But don't stop taking your medication. I've seen patients who stop taking their medication, did not tell anybody, did not call their physician, and guess what? They came in with a blood sugar of 500 and something, 600 and something. It can get crazy, and systems begin to shut down. The liver shuts down, the brain is shutting down, the kidney is shutting down. It's not working well because we are not controlling our blood sugar. It's very important to control our blood sugar. Still talking about type 2 diabetes, we're going to look at the complications because, as I said before, type 2 diabetes can lead to other health conditions if not managed properly. If it's not managed properly, if it's not controlled, it can escalate. Okay, and we don't want that. We want to avoid that as much as possible. When your blood sugar is not properly controlled over time, it leads to complications with risk increased by high blood pressure and high cholesterol. People who have type 2 diabetes tend to have high blood pressure and cholesterol. Those three are always together. So we must control our sugar to make sure that we're not ending up with hypertension and high cholesterol. Okay, now if a person already has hypertension and high cholesterol, they must control those as well to avoid increasing their risk of having high blood sugar. Okay, now these complications can range. Okay, this complication range from blurred vision. You begin to have blurred vision, you're not seeing clearly, see your doctor. Okay, increased risk of blindness. I've seen patients who come in and they've gone blind from having type 2 diabetes. They've had a limb loss from having type 2 diabetes again, so we want to be careful, right? Patchy blind spots, seeing halos. It's just like bright light, but it's like cloudy. Okay, it's like a ring around the lights. So once you're seeing that, you need to see your doctor. Okay, if people can end up with heart disease, kidney failure, numbness. If you begin to feel numbness and tingling your legs, your fingers, you don't want to speak, you want to see your doctor, you want to speak to your doctor so you can manage it in time. In your hands and feet, any numbness, tingling, you want to see your doctor. Reduced blood flow and nerve damage can happen. Okay, and they can go from minor to severe, and it can cause severe infections, ulcers, and a loss of the limb. Type 2 diabetes is not a joke. Okay, I want to make sure that we understand it, we know what's causing it, we know the root, and so once we know the root, we can begin to address it. Okay, we can manage it. We can, when things are happening and you're beginning to see some symptoms, you can speak to your doctor. Do not self-medicate, avoid self-medication, see your doctor, speak to your physician, get medical help, get medical advice. So this week, we just touched on what's the main cause of type 2 diabetes. We talked on the risk factors, we've talked about our complications, we've talked about why a person with type 2 diabetes will have low blood sugar, high blood sugar, what's causing that. Okay, those are the things that we talked about this week. Now we've come to the end of Living Well with Type 2 Diabetes Series 1. We're going to be doing Series 2 next week. I want you to subscribe. I want you to like. I want you to share. I want you to comment and leave your questions, whatever questions you have. Please leave them under this video. Please subscribe, turn on your notification, and I'll see you in my next video. Thank you and have a great week.